With me now is Dr. Chris Bates, Director of Research and Analytics, TPP UK. Dr. Chris, thank you so much for joining us today.
Thank you, it's great to be here.
Can you talk about TPP and your job as well there, please?
Yeah, sure. So at TPP, we're a clinical information system provider, and we provide electronic medical records, both to sort of hospitals and to primary care, really across the entire continuum of care,
Right.
but also up to national levels. So we'll provide electronic medical records for millions and millions of people. And we work, we're based in the UK, there's lots of work in the UK, but we work around the globe. And most recently, we started to do a lot of work in Southeast Asia, in Malaysia, and now here in Indonesia.
Right, so and Indonesia, I'm sure, is going to be a prime market for you, considering the announcements that we heard yesterday about how the facilities have to have EMR by the end of next year.
Yeah, I mean, we were inspired really by the Minister of Health here yesterday, talking about not only the need to have EMR in all those health facilities, but the way he wants to go about it, and the way he wants to make sure that everyone's connected, and that we're centering data really on the patient and making this about the patient and about care. And that's very much aligns with our vision for how the future of digital health should be.
Fantastic. So you mentioned data, and data is also one of the core themes here in this conference. In fact, in one of the discussions that we've had over the past few days, someone brought up in the collection of data which you eventually want to use for insights and your AI work, stuff like that. How do you ensure good data, for lack of a better word?
Yeah, I mean, it's a really, really good question. And there's not an easy answer, but I think there's two components to it.
Right.
I think, firstly, we've been in a situation historically where lots of systems have been in place in hospitals and other facilities,
Yep.
which have really been to facilitate billing and administration.
Right.
So the codes that, the way that the record is structured, it might be not necessarily at the point of care, and it's for payment purposes. And I think the shift to moving that towards records that are genuinely made for clinicians, so for doctors and nurses to help treat patients better, it is then in the interest of everybody to have accurate records with accurate diagnoses, symptoms, medication, laboratory tests, because that allows you to get better outcomes and allows you to care for people better. So I think that's a big component. I think the other thing which will help with this is we're seeing everywhere, and again, something the Minister mentioned yesterday, it is the patient's data. We need to be transparent, and we need to open the data up to patients. And when we do that, we start to see, patients can see their own records. If there's mistakes in there, which will happen, if there's things that they believe need correcting, then we've got that transparency. We've effectively shone a light on that data from the people who know the most about themselves, and that's an opportunity to correct it and to improve data quality. So I'm very, very hopeful, and we know we can collect good data, and I'm hopeful that approach of making the record for clinicians and making sure that patients have access to that data goes a long way to improving data quality in the long run.
Thank you for your fantastic insights on that. I'm sure a lot of people at the conference will really appreciate that. The other theme that we have going on here is reimagining healthcare. So when we talk about reimagining healthcare, what are the things that you would propose? Okay.
I'm a bit of a broken record here because I'm going to mention the Health Minister again yesterday. Right. And I think the core to reimagining healthcare is to centre healthcare on the patient.
Right.
I think that's absolutely key. And I think when we do that, which means the patient has ownership of their record, has ownership of their data, and consequently ownership of their own healthcare and the healthcare of their families, I think that's a big shift,
right.
A paradigm shift in how we'll deliver care. I then think, and again, these were all mentioned in the keynotes yesterday, around that we have three now core opportunities. And I think we're on the cusp of a real golden era for medicine. And I think those opportunities are smart devices and the smartphone, which allow people to connect in a new way with their clinical team, and to have things like continuous monitoring and access and bi-directional communication. I think this is absolutely key. And I think you combine that with the rise of artificial intelligence and machine learning, and as we heard the announcement yesterday around the ability of the genome to personalise medicine, so the 10,000 Genomes project that's taking place here in Indonesia, one of a number of international biobank projects which are going to change the way we do healthcare and allow us to move towards less sort of blunt targets for everybody, that's just the same standards for everyone with a disease, to much more personalised targets and allowing people to really engage with their own personal condition. So I think when we're reimagining healthcare, it's about the patient, and it's about these three new technologies that can really push us into the next wave of how we treat people and get better outcomes and reduce inequalities for us all.
Thank you, Dr. Chris. Perfect place to close.
Lovely.
I hope you enjoy the rest of the conference.
Thank you very much.
Thank you for your time.
Thank you.